I am so annoyed right now with the New York Times description of Trump's doctor. Now, regardless of what you think about Trump's doctor and the press conference that recently happened about the news he gave about Trump, regardless of whether you think it was great, you don't think it was great, what your opinions about it are, I want you to set that aside, because this conversation right now is not about the quality and the content of what he was saying. It's not even about Trump's doctor at all, really, except for the fact that he is a DO, an osteopathic physician. And the New York Times just actually put on social media an article entitled, they just published this, the article is entitled, "What to Know About Sean Conley, the White House Physician," okay? So this is what we are talking about today, is this article as it relates to the New York Times description of osteopathic medicine, for which Dr. Conley is a DO, an osteopathic physician. Let it be known, I am a proud osteopathic physician. I have done videos on being an osteopathic physician. I am a DO. I have been a DO for 12 years. In fact, and I've said this before, when I was applying to medical schools at Princeton, my pre-med advisors at that time did not even tell me about osteopathic medicine. Like many of you, I had no idea what it was. And it was only after I graduated from Princeton and was applying to colleges that I learned about osteopathic medicine. The doctor who treated me and my family growing up in Iowa, who I thought was amazing, who inspired me to go into medicine, was a DO, and I never knew it. In fact, I didn't know it until I was applying to med school as a 20-something-year-old. My mother said, "Hey, you're going to apply to osteopathic school?" I was like, "Wait, what? That's bone schools, right? Isn't that bones and joints?" I didn't know. Turns out, osteopathic medicine is a whole, it's a whole different group of doctors. But doctors just the same, and we're going to talk about what that is. So let me just finish this, because look, I got the pad, I got the laptop, I got information, okay? So let me tell you what happened was, I fell in love with the osteopathic philosophy so much that I decided not to apply to allopathic or MD schools. I only applied to DO schools. Now, what you need to know about DOs and MDs is we are friends. We work together. We are teammates. We are buddies. We are pals. We work together in the office. We work together in the hospital. We don't even see each other as anything differently. In fact, a doctor is a doctor. Many of my patients probably don't even know I'm a DO because we practice just like MDs, which comes, I'm going to get back to my issues with this New York Times article. You see, I'm hot. Okay? So we practice the same. It's probably why you didn't know I was a DO if you're just joining me or if you're new to my page. And maybe if you're seeing me in the office, you don't know I'm a DO, because in addition to some extra skills that DOs have, we practice just like MDs and we work together. My first job was at Sinai Hospital. We taught Hopkins medical students. We had a joint residency with Hopkins. I was a DO working with MDs. We worked together, okay? So I just need to lay that groundwork. And this is why I need you to understand why I'm so disturbed by the New York Times, a publication I respect, still subscribe to. But this is wrong. And by the way, let me tell you what they said. I caught this article in the last few minutes, and to be honest with you, I believe they have even updated some of the language. I don't know if they are learning more about DOs as they go on, but I feel like the article has even been updated since I read it first not too long ago. So this is what the New York Times says about Dr. Conley. Again, we're not talking about Dr. Conley's report about the president or anything. We're just talking about the fact that he's a DO and osteopathic physician. This is what the New York Times says. Dr. Conley graduated from Philadelphia College of Osteopathic Medicine in 2006. Totally cool. This is what they then say. While their training is similar, doctors of osteopathic medicine, or DOs, differ from traditional medical doctors, and that they are trained to look at the body and its care holistically rather than prescribing medicine for specific symptoms or illnesses. First error. That is wrong. It's partially right, partially wrong. What is right, you're wondering? Well, the training is similar. I'm glad they said that, because yes, training for MDs and DOs is similar. In fact, when I was at UMD&J School of Osteopathic Medicine as a medical school student, you know, in New Jersey, there's many medical schools. There's Robert Wood Johnson, there's New Jersey Med, there's Rutgers, there's all sorts of places. Many of our professors that taught us at Rowan, UMD&J then it changed to Rowan, actually taught at Rutgers, taught at New Jersey Med. Those are MD schools. So many of the professors I had taught DO schools and MD schools. The education is the same, first of all. So they are right when they say that while the training is similar. But then when they go on to say that They are, it differs from traditional medical doctors. First of all, traditional medical doctors, the word tradition and traditional implies that DOs are somehow untraditional. That's not the truth. DOs and MDs are both two licensed physicians in this country. Maybe I should go to this computer over here and give some information. If you want to know about DOs, I'm going to sprinkle that in. DOs, go to doctorsthatdo.org. DOs are fully licensed physicians, and I'm reading this because I don't want to get the language wrong because I'm just all like, wah. DOs are fully licensed physicians who practice in all areas of medicine. We do emphasize a whole person approach, but DOs, we prescribe medications, we do surgeries for those who are OBGYNs and surgeons, etc., all of that kind of stuff. That is so important. So when the New York Times says that we differ from traditional medical doctors, what are you talking about? We are fully licensed physicians. And by the way, we are one of two fully licensed physicians that practice in the United States, MDs and DOs, okay? We're traditional too, just needed to say that. Now, the New York Times is correct in that it says they are trained to look at the body and its care holistically. Absolutely right. But they're wrong when they say they do that, DOs, rather than prescribing medications for certain symptoms or illnesses. That is false. I'm in the office a number of days a week. I prescribe medications every single day I'm in the office. This is simply false. And I don't like the tone or this idea that somehow osteopathic doctors are alternative, or we are different, or we are not real doctors. If you want to be honest, that's the implication, in addition to the fact that there are facts in here that are not right. I have a prescription pad. I have a DEA number. I write prescriptions every day. So the New York Times, and let me just refresh. I'm going to refresh just to see maybe they've had more updates. Hold on. I've been refreshing this for the last hour just to say, let me just make sure I get it right. Yes, this is wrong. Still says, while their training is similar, doctors of osteopathic medicine or DOs differ from traditional or medical doctors. We are traditional, and we are medical doctors, in that they're trained to look at the body and its care holistically, true, rather than prescribing medicine for specific symptoms or illnesses. Which is not true, okay? We are, and we do look at the body holistically. And we practice surgery. We practice in all disciplines. DOs are dermatologists, internists, ER doctors, family doctors like myself, cardiothoracic surgeons, plastic surgeons, you name it. You look up online, what's the difference between a DO and an MD? We all do 4 years of medical school. Then we do a residency on top of that. Yes, between 3 and whatever years, depending on the residency you do. I did 3 years of a family medicine residency. That's the same as MDs. We both take licensing exams. That's right. And actually, DOs sometimes take the MD licensing exam. And now, MDs can also do stuff that DOs have traditionally done in terms of licensing exams. Now, let me go on in this part of the article because y'all need to know this. It says osteopathic doctors are required to complete additional coursework to understand the body's bones, muscles, and nerves affect overall functioning, such as applying pressure to or stretching out joints or muscles. So now that is true. But what I don't like is that they didn't call it what it is. There's a name for that extra training we have. It's called Osteopathic Manipulative Therapy, OMT. It is pretty freaking awesome, by the way. And what I describe it as is it's like a little toolkit. It's extra stuff we have in our toolkit to help treat people. So it's a hands-on sort of training that we learn in addition to prescribing medication, surgeries, and all that good stuff. If somebody comes in with low back pain or headaches or other issues, we also often can offer hands-on manipulative techniques to help the patient right there in the office at that time. It is not what chiropractors do, but I often say and sort of associate it with chiropractors, not because we are associated, but because people often understand what chiropractors do in terms of using their hands on the body. So we're not chiropractors. Chiropractors are not DOs. But you think about the visual, and that osteopathic manipulative treatment is an amazing therapy that can be an adjunct to so many other things: physical therapy, medication, surgeries, whatever you might need for whatever condition you have. By the way, a little plug is that if you've got low back pain or other musculoskeletal issues, and by the way, we don't just stretch out the joints and muscles like the New York Times said. I expect more from the New York Times. I'm sorry, I expect more. They're some of the brightest people on the planet. I don't know what kind of backlash I'm going to get from this, but I expect more. I do. Call up a DO and ask. Call us up. And honestly, doctors that do, or osteopathic.org, you can go there right now. Get your other laptop, get your Apple, and get up on there and see what you're talking about. You'll see what I'm talking about. Okay? So we don't just stretch out the joints. That's inaccurate. There's a name for it, osteopathic manipulative therapy. It's studied, it's researched. We have a journal. We're real doctors. And I hate that I have to say this. I've been in practice for 12 years. And yes, over the years and in history, there has been a bias against DOs. I would be lying if I didn't say that. I told you, for those of you who are just joining this chat, I chose to be a DO. When I learned about osteopathic medicine, I actually withdrew all of my MD school applications and only applied to DO schools because I love the philosophy. I love the idea of the hands-on medicine in addition to prescribing medication, surgeries, and all these other things. And I love the way we practice and we work with MDs and we are buddies and we are pals and we work together. So it's not a competition thing and it's not a one-up thing. That's not, you ask an MD, ask them. That's not how it is for us. So that is wrong and it is false. Let me see what else the New York Times says about this. What they do say is that Dr. Conley, again, I'm referring to the New York Times article about Dr. Conley, who is Trump's doctor. My issue with their article, and by the way, I want you to pull this up. You can Google the article. It says, what to know about Sean Conley, the White House physician, okay? I'm not talking about Sean Conley, the doctor, in terms of his medical decision-making. I'm not talking about the press conference he gave, the information he talked about President Trump, that information that he left out. I'm not talking about any of that. What I'm talking about is the New York Times description of his degree as an osteopathic physician. They are wrong in a lot of places, and this is what I'm talking about. I hope that you share. I hope that you share this wide and large, because it is so important for people to know. Your doctor might be a DO and you may not know it. And you know why you may not know it? It's because MDs and DOs, we function the same. DOs, we have extra training in musculoskeletal medicine. That's this osteopathic manipulative treatment that I was talking about, which has been studied and which is very important and a really great adjunct to prescribing medications and doing surgeries. But not every DO does OMT. Your doctor may or may not. DOs and MDs are the two types of licensed physicians in this country. There are only two doctors that are licensed to practice medicine and surgery in this country, MDs and DOs. I just needed to set the record straight. And New York Times, I am disappointed because DOs are not new. We are not alternative. We're not soothsayers. We're not untraditional. And in fact, as I said before, and I don't want to repeat myself a lot, DOs and MDs, we work together. And as I think about, okay, what's the bright side in this New York Times article coming out that has sadly misrepresented osteopathic physicians in a way that makes me feel like I have to defend myself, my reputation as a physician, my proud reputation as a proud osteopathic physician, which I chose. And I chose to be a DO over applying to MD schools and defending my colleagues. You know, the bright side to that is that it's my chance to hopefully give some information to you all. Maybe you didn't know the difference about DOs and MDs. A lot of people don't. That I know. And so I'm hoping that this is an opportunity for you maybe to learn something you didn't know. The next time you go to your doctor's office, take a look at their white coat. And when you see doctor, look at the end of their name and see, do they have an MD or a DO? And if they're a DO, ask them about their training or ask them, you know, where they went to school or what have you. Or, okay, you don't have to. I mean, this doesn't have to be like a kumbaya moment. But my point being is, despite how disappointed and upset I am, especially in this day and age, often as DOs over the years, we've often had to defend our reputation. And that's a shame. And people choose DO sometimes over MD. I chose to apply to DO schools and I chose not to apply to MD schools. Nothing against my MD counterparts. Like I said, we're buddies. We work together. Our goal is healthcare. We are the two licensed physicians in this country that can practice medicine and surgery.